What should I know when first diagnosed with follicular lymphoma?
I think it's important to know that, as mentioned previously, in most of times, it will not affect your life expectancy. The most of times, you may not need treatment. And if you need treatment, it's really with the intent of trying to achieve what we call a response that could be complete or partial, so that you could spend as much time as possible without treatment. One other thing to know is that based on the amount of disease that a follicular lymphoma patient has, treatment may be completely different. So for those who have what we call low tumor burden lymphoma or very small quantity, options are just observation or something as simple as an antibody called rituximab. But if the amount of disease is more, or what we call high tumor burden, then those patients need to be treated. Currently, the standard treatment for high tumor burden, advanced stage follicular lymphoma is represented by chemotherapy, but we are all doing a lot of work trying to shy away from that and develop more immunotherapy for those patients. Finally, if the disease is very localized, so stage 1 or 2, actually radiation may be an option. We now have very long-term follow-up for patients who have radiation 20, 30 years ago, and 60 to 80% of them, particularly if they have stage 1, a small lymphoma, they're still disease-free. So you may argue those patients may be cured.
I try to get a sense, namely initially, if the patient, if this is something that I think the patient needs some sort of treatment for soon. And then I think beyond that is try to understand how we can best build, something like a 30-year plan for dealing with follicular lymphoma in patients, because it's, I was kind of taught, my training, that it's something that should be, in most cases, a slow-growing illness. And so you don't want to do too many treatments too early, or too many CAT scans that raise the risk for other, other cancers or other problems in the body. And so I think we take an individualized approach to helping patients understand that illness. But I really try to in patients that clearly have slow-growing lymphomas, to help them understand that, this is going to be something I think we can manage for many years at a time. I think in the more aggressive cases that we see is to help patients understand that, they may have a different type, but we still have effective treatments, but that we have to think about, trying to sequence things in an ideal fashion. And often in younger patients too, I'll also have discussions about trying to rely on chemotherapy-free things to save them potentially from longer-term side effects, because we may be trying to deal with this for 30, 40 or more years. And a lot of those discussions actually get into, the better we can kind of, be nice to the patient's body and get them, longer terms without, undergoing very aggressive treatments that may be meaningful in terms of their survival or function in life. Is the other idea that the longer the patient goes, is the better therapies are going to be out there, and ideally more cures for follicular lymphoma in that sort of future trajectory of these patients.